Hi, this is Dr. Leonette from Enliven. One of the key treatments that we do is an upper cervical correction. That's the correction of the first vertebra right here below your head where your neck comes together. And it is a very powerful area. So I'm going to pull out my trusty little spine here. So I'm sure you guys have all seen these spines. We have the head, and then we have this vertebra right through here, and then we have the rest of them. And all the rest of them have these areas back here where they touch. This one has this ability to turn your head sideways, go back and forth, and allow you to nod. And then one of the other features you're going to see is the red that goes up through here. This represents the vertebral blood supply. So we can see it does 4 90-degree turns before it goes into the cranium. And then down through here, we have the brain and where the spinal cord come together and the brainstem. There's a lot of significant neurologic and vascular tissue right in this area. So we want to take the most amount of care to put this back in place. And so first what we need to do is assess where it is, what the misalignment pattern is. So we look at it from the front view, we look at it from the side view, and we want to get it squared back over the head. And why is that so important? Well, if you've ever looked at a kettlebell, if you guys have ever held a kettlebell, you see it's got the handle on one side, weight on the other. But your head is basically like a kettlebell turned upside down. And then we have to balance it, and this one's a 10-pounder. And we're just going to try and balance that all day on like bones that are about the same size as 2 fingers. So we have a lot of work to make sure this thing is perfectly balanced neutrally, sideways. So if we have it tilting off that way, it takes a lot more muscle strain, a lot more activity to try and get your body and your squared away. So an upper cervical correction can change the alignment going all the way down through the rest. It can affect your lower back, your knees, your feet, but a lot of times we're talking about like head issues going up. So one of the key things we do is we look at x-rays. I take 5 x-rays of your neck and I'll look at this alignment right through here. And it's going to be a little difficult to see because number one, we're on a computer, but number two, I've also been training a long time to look at this. So we have the head, and where I showed you before, we have like a little bit of rounded circle right through here. And this bone kind of comes up like this. I know it's really hard to see. I look at where that is in relation to the weight-bearing center of the skull, and also where the canal is that goes down the neck. So this is where the spinal cord travels. So I want to make sure that is lined up. The technique that we have been trained in is called Atlas orthogonal. Atlas refers to the top vertebra. Orthogonal refers to 90 degrees. So all we want to do is see this alignment to be here in 90 degrees. In this individual, I look at all these numbers. This is like engineering and chiropractic come together. These tell me, okay, this person is off 2.41 degrees here on the right side. Their second vertebra is spun around a lot, about 6 millimeters, and then the neck, oops, right down here is off 3 degrees. So essentially, this person's bone has tilted up like this. And so now we have that imbalance like I showed you with the kettlebell. And then one of the other really cool things is where I take a person's, we put their chin on the board and we take an x-ray looking down that way, and we see where that first vertebra sits in the plane going this way. And so in this case, this individual is sitting on the left side, their left side's anterior. This is all gets a little technical, but what that does is that gives me this batch of numbers over here, and that tells me how to align you real specifically on a table so that we can do an adjustment where we put a little stylus behind your ear and it goes click, and it uses a sound wave to get you balanced right back out. This is one of the most fascinating chiropractic techniques I've ever used. It's one of the most powerful ones I've ever used. We get really good results with everything from head, neck, dizziness, even sometimes with lower back. And so if this is something you would like to try, you'd like to have a little, see what happens with your x-ray analysis, please let me know and let me see if this is something I can help you with.